Good morning. Welcome to this special dialogue session at the NF Day 2025 International Summit. I'm Dr. Zhichao Wang from Shanghai Nice People's Hospital, Shanghai Jiao Tong University School of Medicine. So it is my great honor to host this exchange dialogue with our esteemed, world-well-known international guest, Professor Berman from the Royal North Shore Hospital in Australia. Today, we'll focus on very important key issues in the management of NF1-related plexiform neurofibromas. So shall we begin?
Absolutely.
Okay. I would like to start our discussion with the very first question. MEK inhibitors has been approved for the treatment of NF1-related plexiform neurofibroma. Based on clinical experiences, what specific changes have these drugs brought to the management and outcomes of NF1-related PN patients? Maybe you can give us some insight on this question.
Absolutely. I mean, I think this has been incredibly transformative. I've been working with NF1 for more than 20 years.
Oh, 20 years. Okay.
and really, our patients really suffer from a long course of chronic illness, and have really had very little hope for treatment options previously. This is a massive paradigm shift for us. We have something to offer. We have approaches that can help our patients to overcome some of these terrible morbidities that are associated with plexiform neurofibromas. So I think it is really transforming care. It's also transforming lives of patients. But one of the things that's really interesting is it's bringing other specialists in. It's making people more interested in understanding neurofibromatosis. So I think even beyond the patient experience, it's actually bringing NF1 into the light and allowing us to now engage with other clinicians and other researchers who are now interested, and I hope that we will make great pathways forward as a result.
Sure. Previously, when we encounter NF1 patients in our clinic, the only thing we can offer is debunking surgery or wait and see. So we have another weapon to deal with to help these patients to reach for better outcomes in clinical settings. But I think that is only one very first step that we are taking. There's many other trials and innovative drugs are taking place worldwide. So I think we can bring more bright futures in this particular community. Okay, thank you very much for your insight. So I would like to ask the second question. What do you consider are the most unmet clinical need in the future treatment landscape of NF1-related plexiform neurofibroma?
I think, as you said, this is step one. We now have something, and it does a bit. It helps somewhat. It has an impact, sometimes a quality of life impact that is enormous, but this is not a cure. In most patients, we're seeing volume changes that are in the order of about 20 to 50%. We are not seeing complete shrinkage of the tumour. So we need new therapies, we need additional therapies, perhaps that will be in addition or used in combination with MEK inhibitors to further reduce the volumes of plexiform neurofibromas. But the other thing is that we're, even just in terms of understanding how we use MEK inhibitors, there are so many things that we are all learning and we are all trying to come to grips with about how do we decide when to start therapy, how long should we stay on therapy, when should we stop therapy, and which patients respond and which patients don't respond. What are the factors? What are the factors that define a plexiform neurofibroma that will respond to MEK inhibitor therapy?
And more importantly, I think plexiform neurofibroma through our study consists of great heterogeneity within the definition of plexiform neurofibroma. You can see the patients all come into a clinic with a complaint of plexiform neurofibroma, but the clinical presentation varies from one patient to another. So personalized medicine should be the future direction of better characterize plexiform neurofibroma into subtypes. Therefore, we can give more precise recommendation of which patients will benefit from which therapy.
I completely agree. And I think one of the things that we struggle with is that we don't have enough data. And we don't have enough data from diverse populations. We don't have head-to-head studies from multiple centres especially with placebo control. COMET was the first study that used a placebo control to understand truly what is happening across different populations, different ethnicities, I think is very important. And pharmacogenomics, I think, is one of the things that we need to explore to understand which patients are going to respond and how well they're going to respond. But I agree completely about the definition of the plexiform neurofibroma. There are many different subtypes, and I think that hasn't been properly characterised. I also think that the genetics of those tumours is very interesting, and that has also not been properly characterised as yet. So that will be a new issue for us to address in the future.
Okay, I think that you mentioned a very important issue and topic, is that previously the Chinese scholars do not put pay so much attention in this particular field. So previously, all the evidence-based data was generated in Caucasian populations.
Yes.
So as we discussed previously, we have conducted a retrospectively analysis of Chinese multi-center cohort to analyze the phenotypes in NF1 in Chinese patients. We found great heterogeneity and difference compared with Caucasian population. For instance, not to say the plexiform incidence is a little bit different, but we can also observe the OPG incidence in Chinese and Asian population is 14 times lower compared to Caucasian population. So, but I think that means NF1 genes is not only the contributor to the phenotypes, there's many other genes as a whole, and also environmental factors contribute to the phenotype of the patient. So learning the difference between two ethics can help us to better understand what is making a contribution to the phenotype of the patient, and we can come up with better treatment strategies targeting at the other risk factors to prevent OPGs, for example, from happening in Caucasian population, and other makes the plexiform neurofibroma more personalized. I think there's many things we can collaborate between Australia and China and to make a contribution, make a difference in this particular field.
Yes, I completely agree. I think collaboration is key. We're not going to solve this in one centre. Sure. This is something where we need data from across multiple centres, and I think that process of standardising what we're collecting so that we can compare across different sites is one of our key elements for a success in future.
Yes,
absolutely.
That's why I think that 2025, the NF1 Forum Day today set a very good platform for us, international NF1 experts, to stand in the same platform to communicate with the expertise we generate from our clinical practice, that we can better help this community, right?
I agree.
And I'm aiming for future academic collaborative projects that we can really conduct bilateral academic research, both clinically and biomedically, to help these patients to develop more efficient therapies in the future.
Absolutely.
Okay, so let's listen to the final question in this interview. Across the whole disease journey of NF1-related PN patients, what scientific or clinical research directions are worth exploring from your perspective?
One of the things that we really find extremely challenging is malignant peripheral nerve sheath tumour. Okay. The transformation of NF1-PNs into malignant peripheral nerve sheath tumours. Our patients live with terrible worry their whole lives about cancer.
Sure.
And we really don't understand what it is that defines those 10% of patients, about 10% of patients with plexiform neurofibroma who develop malignancy within that plexiform neurofibroma. What is it about that patient that they develop a malignancy? And I think that is a really crucial part of our understanding, so that we know which patients we need to monitor closely. Is it just random, or are there specific factors? And I don't think that we've really explored that very well. Also, treatment options for MPNST have not changed significantly for a very long time. Right. And the outcomes are dismal.
Yeah, that's right.
5-year, 50% survival, that's just not good enough.
Yeah, that's right.
And we are in a place where we are probably the ones who are going to have to solve this problem, because MPNST in the general population is so rare that early detection and diagnosis and then better management is really probably going to come from our community.
Sure.
And I think that's something that we really need to focus on.
Sure. I think that is a very, very good question that we need to treat and to explore in the future. Because in terms of plexiform neurofibroma, what we are talking about is quality of life. It's benign tumor you can carry maybe all the time along your life. But in terms of the situation of MPST, what you are really talking about is life and death. So that is a more important issue that we need to explore in the future, and there's a great unmet medical need in this particular population. It's a more specific subtype in NF1-related PN. Okay, so that's all for today's interview. I hope that in the future we can collaborate more, and thank you very much for sharing your valuable expertise and perspective today. So this dialogue highlights the progresses and ongoing challenge in managing NF1 patients, both in China and in Australia, and I think this challenge also spread worldwide and has pointed out towards meaningful directions in the future to research and collaborative opportunities. I believe that our exchange will impair future discussions and innovations in this field. So thank you very much. Thank you, Dr. Berman, and thank you everyone for listening. Thank you.